Dr. Emmanuel Emuka. I'm presenting the Nigerian implementation research, looking at the evaluation of transition to government ownership of schistosomiasis and soil-transmitted helminth control in 4 districts in Nigeria. These 4 districts are located in Delta, Edo, Nasarawa, and Plateau states. We are going to talk on health and neglected tropical diseases. And our main theme is on transition of campaigns to health systems. The project team is the Carter Center, led by Lindsay Rakers, Dr. Gregory Noland, the director, Emily Griswold, associate director, Lauren Shoemaker, senior associate director, myself, Dr. Emmanuel Emuka, a project director, Dr. Eben Egege, a project director. And we have with us here, representatives from the state and ministries of health of Delta and Edo states. And then we also have those of Plateau and Nasarawa states in this call. Next slide. The background and the problem to be addressed. We are discussing 2 parasitic diseases, schistosomiasis and soil-transmitted helminths, that are endemic in Nigeria. Nigeria is one of the largest countries in West Africa. We have about 43 million people at risk of schisto and about 35 million people at risk for soil-transmitted helminths. Now, these diseases are by WHO requirements, control programs with the mass drug administration. However, these programs, strategy requires an indefinite treatment approach, which many, agencies and donors advocate for mainstreaming. That is, seizing external support and transforming these programs into the primary health system of the country. We have problem gaps that we need to address. One, presently, there's lack of clear direction to NTD programs to transition their shared support from partners and government, and a way to ensure that when the partners leave, that the program will continue to maintain its treatment achievements. So that's the main gap that we have. That clear direction is lacking. Next. What is the purpose and intended application of these findings? Now, the purpose here is to evaluate the transition of schistosomiasis and soil-transmitted helminth mass drug administration programs to primary healthcare system, or any routine program that the ministries of health and the education will find fit in these selected districts. And we hope that the results will inform transition plans in many districts in Nigeria that are over thousands in number. And we expect that this study will contribute to the blueprint of the Nigerian NTD master plan, if they fully own up the program. And we hope that the outcome of this study will also be part of the Nigerian NTD master plan, and the results in positive outcomes in the years to come. And we also bring positive impact in the affected schisto and STH communities. The barrier to this full ownership is lack of dedicated government funding for NTD programs. Next slide. We propose some research questions that will help us to address this. One will be, one of the research questions is, how will this how will the treatment coverage of the districts that are conducting schisto program in Nigeria change when the district is transitioned from partial support to full government ownership, in all the levels involved in the school-based mebendazole and the praziquantel distribution. We hope to address this, issue of coverage by conducting coverage surveys. First, we do the first round treatment before the transition occurs and measure the impact. Then we do the second coverage after the transition has occurred to also evaluate the impact. The second question that we address will be how will this transitioning support for the schistosomiasis, STH, program affect the government, distribution of responsibilities and the mechanism of the MDA among the staff of the local health system. Now, this question we will address by conducting planning meetings with the government officials. We're also going to conduct interviews of the personnel positioned throughout the health system, that is at the state, local government, ministries of health, education, and then also on frontline health facilities. This will be done at multiple points to address, or add context and clarity to the mechanism and the effects of mainstreaming, as well as help us to articulate the barriers, that may exist when government fully owns the NTD program. Next slide. What is the anticipated project timeline? So we are proposing that between June and July this year, we are going to hold or conduct planning meetings. We are also going to conduct interviews and then the first round of treatment. Between July and August this year, we conduct the first coverage survey that will give us the baseline, of what we expect will be sustained by the government. By September to December 2021, we will compile our first report of the round one activities and, and submit to SCA. By February 2022, we conduct the second planning meeting and interviews that will usher in the second round of MDA. And this round of MDA by May 2022 will be conducted by government and its structure on full ownership. By June 2022, we evaluate the outcome of that intervention carried out through coverage survey and interviews. By July 2022, we now conduct our second round result compilation. We also hold final meetings with the partners, and then we debrief. And then by that later part of July 2022, we send in our final report to health campaign effectiveness of the global task force for global health. Next slide. So we expect some challenges, at least within the next 6 months. And looking at our environment in Nigeria, the first challenge that we identified is government buy-in on the transition plan. And for us to address this government buy-in, and we had a set of mitigation plans. The first is that we have commenced frequent communication with government personnel, and we are also creating all the plans for this research with them. Some of them are here with me, and some are also in JAWS with Dr. Ebelegege. One thing that is inherent in this study is that the government input and feedback is very important, especially in interviews. Another area of challenge we anticipate is drug supply. This, we believe, we will work with the national pharmacists, with the state and local government personnel that are involved in drug logistics. This is to ensure availability of medicines, that's praziquantel, mebendazole or albendazole, as the case may be. Our good, option here is that historically, Nigeria's ability to borrow medicines within states is something that we have, succeeded to achieve, and therefore we don't anticipate any problem as such, as most medicines can be, pulled from different, states or districts to ensure that we succeed in this study. Next slide. Thank you very much.